a platform that attracted healthcare experts and industry representatives.
Ladies and gentlemen, I welcome all of you to the India Health and Wellness Summit and Awards 2015.
To discuss and initiate dialogue on healthcare from a larger perspective.
The concern about the health has increased multifold. And initially the diseases used to be the communicative diseases, but now they have changed to the lifestyle diseases.
Health is not something which you fall sick, you go to an hospital and then somebody will cure you and then you will become healthy. A human being have to become healthy in his normal life.
We've often talked of India's demographic dividend. It is also a fact that if you cannot train, skill and educate these young people and if they are not healthy, you can actually have a demographic nightmare.
अगर आप अवेयर नहीं होंगे, हेल्थ तो छोड़िए आप ही नहीं रहेंगे. अगर हेल्थ के लिए जैसे कि बात हो रही थी, सड़क पे आप चल रहे हैं, मॉर्निंग वॉक कर रहे हैं, एंड इफ़ यू आर नॉट केयरफुल, पता लगा एक्सीडेंट हो सकते हैं. और हेल्थ को अगर प्रोटेक्ट नहीं करेंगे तो जीवन में कुछ भी नहीं कर पाएंगे.
The India Health and Wellness Summit and Awards 2015 kicked off with the agenda to devise the roadmap for improving health outcomes in a country of nearly 1.25 billion.
Kindly release the India Health and Wellness Summit souvenir.
Today's event for me is around the whole area of healthcare in a larger context of health. To us, nutritional availability, nutritional accessibility probably is the foundation for all of this. There are 6 sessions for the day, and each of these sessions have a large role to play.
You are asked this question, you can send a mission to Mars, but what about undernutrition in your own country? So I think it is important that we address it collectively. So we have decided within NDDB to set up a non-profit registered society called NDB Foundation for Nutrition. And the idea is to connect our milk cooperatives with school children. What we are planning to do is to have this big vision of a glass of milk for every school child who cannot afford it, or every child who cannot afford it.
The day-long deliberation saw the first session focus on good food, good water and good air for all to achieve better health.
In large parts of the country, between sunrise and sunset, a woman and a girl is unable to relieve herself. And even if she does, it's out in the open. Now, with your background, how do you stitch that together into looking at where her condition is going to be?
Imagine the whole population of the United States of America, plus Canada, plus parts of South America, having no toilets. And now imagine where you would go. So that's the situation that you're talking about, Bobby, in terms of the numbers of people every day that don't have a toilet in India. And currently it stands at 564 million people. So if we're talking about access to clean water, irrespective of where your water comes from, the quality of that water will be compromised. It'll either be compromised because there is so much excreta in the environment, or it'll be compromised because on your hands, you're carrying that excreta. So for a woman, and for the children that she bears, there are 26 million children born every year in India. And a significant number of those children are born into a family that has never used a toilet. So as you've said this morning at the inaugural session, those women have to be healthy. But in an environment that I've just described, that's more or less impossible.
We're talking about how do we make sure that we have a demographic dividend, which is better youth, better skills. Pulling this all together in a healthful environment, how do we apportion, as you speak in the government, the rules of business or the areas of responsibility? How do we kind of do it? Is it government? Is it industry? Is it the private citizen? How do we play this together?
I think where we fail as a nation is in delivery or in enforcement. Whether it is a program delivery or in enforcement of a regulation, I think we have a kind of chalta hai attitude on both. We have also a serious weakness in designing systems which are transparent and enforceable, and also in finding solutions which are affordable. Now let me go back to something that Sue talked about. I worked on drinking water and sanitation in the 80s in Government of India. And one of the challenges we had at that time was clean drinking water. So I think we worked with UNICEF for about 3 years in designing the India Mark II hand pump. Now that was an extremely important technology intervention to provide water to remote villages in India. But what do you do when you start polluting surface water? One of the biggest challenges today is not so much of availability of water, but I think availability of good quality water. And I think we pollute as if there is no tomorrow.
Of this 1.25 billion people, how many do you think, if we just went out in the streets and did a census-wide test, would probably be telling us that they are either tending towards diabetes or frankly are diabetic?
The estimate is that we have 66.8 million diabetics in India.
66.8 million people is the estimate of the number of people living with diabetes in India.
In India, which includes rural and urban population. If we go in the city like Delhi, possibly we have about 12 to 14% of the adults who are diabetic. One of the key drivers that is, leading to increasing numbers of diabetes is increasing weight, increasing belly size of the population.
What is coming to me as a real surprise is, much as the statistics clearly indicates serious problems of NCD. I mean, it's pandemic. And some of them are actually leading to become epigenetic as well. In this context, bulk of the problem is actually at the individual level. It's our lifestyle and it's our food. So now the issue is, we believe if we were to take care of good nutrition and good health, good nutrition, it can play a significant part in reduction of the problem.
In fact, if somebody is diabetic, now I will label him that he has a heart disease.
You will
just label him
that
he has a heart disease, because he has 80 to 85% chance of developing heart disease in his lifetime. If you don't wake up, we are sleeping in this country.
Right, fair. Waking up means what?
Waking up means aggressive preventive policies of the country.
What would be that?
When we say aggressive policies, the onus lies on me, the onus lies on the government of this place, the onus lies with all of us.
What is happening with our lung health situation in this country?
Chronic lung disease that is perhaps has not received the attention that it deserves is COPD, what we call as chronic obstructive pulmonary disease. Right. What is interesting is, in the Western world, COPD has always been believed to be associated with tobacco smoking. In India, that is not the case. More than 50% of the COPDs in India have never smoked in their life. And this is largely because of the high levels of air pollution that their lungs are exposed to. Despite the fact that there is now very good evidence to suggest that air pollution not only affects the lungs, but after affecting the lungs, it also affects the heart. So there is a direct as well as indirect effect on the heart from the lungs.
I think a stage has come where food solutions will be the norm. Because it will be difficult for you to change too much of the lifestyle, because it's not simple, it's not going to be easy.
We seem to be fairly good at understanding what is investment. As far as health and development is concerned, that health is an expense, not an investment. At least that's how we do our balance sheets at the big levels.
As an economy, we have been short on resources, and any organization, any country, any company which is short on resources, is going to be careful both how and where it spends its money. The needs for us to spend on areas like training, skills, education, clean drinking water, sanitation are huge. And healthcare is very much in the same list as an essential requirement. But because it is not the only one, it is still an area in which you get part of the allocation. And as long as you're getting part of the allocation, I believe many will still look at it as a cost.
Last 10 years, between 1996 and 2007, the USA heart disease incidence came down by staggering 27%. And here it is just opposite. Next 15-20 years, the prediction is from current 35%, it will go to more than 70% when you add up all the lifestyle diseases, non-communicable diseases and accidents. 75% staggering. The entire policy focus, everything has to change towards healthy lifestyle.
Focus on health insurance has been negligible in our country. Even today, I suppose the kind of penetration which is there, unless we change a system where we can bring more people into the spectrum.
Actually, it's more than that.
But there is a problem on the other side as well. Both on our abilities to supply the capacity. One is not enough people in getting insurance or the ability to pay, but actually even if they could pay, where do they go?
Right.
So where is our scale? Where are even the doctors? Our current system militates against creating more doctors.
और दिल्ली में हम 3-tier system को 5-tier में change करने जा रहे हैं. अभी तक 3-tier था, primary health care, secondary and tertiary. उसको हम change कर रहे हैं primary health center, secondary की जगह multi speciality hospital, then super speciality hospital. उसके बीच में जो हमारा प्राइमरी सेंटर है जिसको मोहल्ला क्लिनिक कहते हैं, हम पॉली क्लिनिक्स बना रहे हैं. जो एग्जिस्टिंग हमारे 200 डिस्पेंसरीज हैं, अच्छी बिल्डिंगें बनी हुई जिनकी, उनको हम पॉली क्लिनिक में कन्वर्ट करेंगे, 4 से 5 कंसल्टेंट वहीं पर बिठाएंगे. तो चीज़ों को बेटर करने पर कॉस्ट भी कम हो जाती है, सेटिस्फेक्शन लेवल भी बढ़ जाता है, और मुझे ऐसा लगता है कि हमारे को अपना लेवल उठाने की ज़रूरत है ताकि कॉस्ट कम हो सके.
Thank you so much for that session. I would now like to invite Nikki Gupta, CEO of Teamwork Health, to kindly hand over mementos to our panelists. Mementos for Mr. Satyendra Jain, Minister of Health, Delhi.
The India Health and Wellness Summit and Awards 2015 saw massive participation from industry and policy makers alike. The stimulating environment helped discuss several burning issues.
Healthcare is not really about only hospitals. It's also about clean environment, it's about sanitation, it's about good, clean drinking water, it's about access to good food and nutrition.
The whole panel concluded with that discussion is to bring out data, collate the data in healthcare and make it available digitally for a monitoring system.
All malnutrition issues are not of energy or the bulk of the consumption, but the micronutrients. So these, whether it is milk, whether it is pulses, whether it is dairy products, edible oil, they can really be great carriers of micronutrients.
The awards recognize and celebrate excellence.
The summit culminated into an evening that applauded and awarded individuals and organizations working to improve the country's healthcare scenario.
I would now like to invite the jury members on stage.
In my opinion, this is the second edition of the award, and this has been an extremely detailed process for the entire jury.
Definitely in healthcare, when we talk, then it brings about quality. It brings in quality improvement program, and also it helps the public at large.
We really feel pride in saying and accepting that we at India have got much to deliver to the world as regards to health and wellness. This is the high time we have to address such issues of what we call as a preventive medicine and curative medicine. Curative medicine is, of course, by compulsion, no choice for that. We have to get the treatment done, whether domestically or internationally. But preventive medicine, or what we call as wellness spas and wellness medical centers, have a big role to deliver to the national health and, of course, the national economy.
I would now like to invite Dr. Sharma once again and the chairman of the National Dairy Development Board, Shri T. Nandakumar, to please come up on stage. Let us begin the award ceremony. Our first award is the Single Specialty Hospital Brand of the Year.
And the winner is Bornhall International.
Now we have a special award. The India Health and Wellness Awards recognizes the traffic police of Department of Delhi for harnessing public infrastructure and services for the cause of health.
Indian Health and Wellness Award 2015 recognizes Delhi Traffic Police for public infrastructure and services for health.
This recognition is particularly in connection with the Green Corridor that was created on the 3rd of January 2015 from Sector 44 in Gurgaon to Fortis Escorts Heart Institute in Okhla across a distance of 30 kilometers. We are now joined by Special Commissioner, Delhi Traffic Police, Shri Muktesh Chandar, to accept the award. Healthcare Entrepreneur of the Year. The award goes to Dr. Dharminder Nagar of Paras Hospitals. The next set of awards, the first award in this category, Excellence in Medical Technologies.
And the winner is Fortis Escorts.
Our next award is Healthcare Innovation of the Year.
And the winner is GE Healthcare.
The next award is for Diagnostics and Preventive Healthcare Brand of the Year.
And the winner is IBSC India Wellness Limited.
The next award is for Impact Innovation of the Year.
And the winner is Dr. B.L. Kapoor Memorial Hospital.
The next award is the Wellness Service Brand of the Year.
And the winners are Kaya Limited and Spa by JW Marriott Mumbai Sahar.
And our next award for Public Health Communications Campaign of the Year.
India Health and Wellness Awards 2015 recognizes UNICEF for the Public Health Communications Campaign of the Year.
All the awardees, I would request all of you to please come up.
it's not that we do not have the infrastructure, we do not have the medical care facilities, we have them, but the lack of awareness in the general public is still very little.
Huge number of people don't have any access, neither they can afford healthcare. So there is a huge potential for us to do a lot of things, and I think together we can do a lot. And next 10-20 years I see a lot of further progress happening in the healthcare.